It is time to let it rip, and tonight's topic, to mask or not to mask when it comes to Metro Detroit schools. The state school board meeting yesterday deciding to leave mandates up to individual districts. Joining us tonight is Tom McMillan, a Republican member of the State Board of Education who helped craft that decision, and R.J. Weber, assistant superintendent for Novi Public Schools. He's also a lifelong educator and a parent himself. We also have Julie Madej, who has children who attend classes in that district, and she believes mandates are not the answer. We also have Reverend Keon Payton from Pontiac, who's also a father and thinks every school system in the state should be requiring masks. And Dr. Justin Skrzynski agrees. He runs one of Beaumont Hospital's COVID units. And of course, we're joined by the one and only anchor attorney, the hardest working man in television, Charlie Langton. It's good to see all of you. Thank you for joining us. I think the best thing to do is to begin by getting somewhat of a progress report. I think a lot of people have COVID fatigue, safe to say, but let's get into the ward for a moment and talk about the important work that's being done. Dr. Skrzynski, talk for a moment about what you're seeing relative to the Delta variant and people who are unvaccinated.
Right. So we are seeing a definite uptick in cases. Now, I'm not trying to pretend that this is at all the number of cases that we're seeing back in the spring or back from the previous fall, but it is an increase, and that's an alarming trend. We know that Delta is more contagious, and now there's some concerning suggestion that even vaccinated people can still spread Delta. So lots of reasons to be cautious, especially moving into the colder months where everyone's inside.
Got to ask you the question. I was talking to a couple of doctors today. One doctor actually said that this is a little bit different because of the fact that we're going to see numbers rise. People will get infections. We will see breakthrough cases. But we also understand, and we have to make this clear, people who are vaccinated don't get as sick at all.
Absolutely. That's a huge point to emphasize. So the vaccine is still the best tool that we have to end the overall pandemic. But again, the problem is, and that's the reason why the question of masks comes up, is how do we stop this increase in cases here and now? We know for a fact that vaccines aren't going to be effective in individuals after a few weeks after the last dose.
Tom McMillan, State Board of Education, making, of course, that big decision about letting the districts decide on their own whether or not masks should be mandatory or not. Tom, if it was up to you, what would you say?
Well, actually, yeah, I did not craft what passed. I crafted something that I introduced, and actually they substituted out the Democrats. So I oppose any mask mandates, and I just would. It should be done at the local level, but I would urge, and I wanted my resolution to urge local districts to not have mask mandates. Let the parents decide. It's clear that these children are not at risk, not nearly as much as at risk as the older populations. And it hurts their education, and people can get vaccines, the adults and those that are at risk. So there's no reason, and it's really like what was described by John Hopkins professor recently in the Wall Street Journal. It's child abuse to require these mask mandates.
But to wear a mask, you think, is abuse?
Well, that's what the professor John Hopkins School in the Wall Street Journal said just a few days ago. I mean, if they don't need it and you're forcing them to have it and they don't want it, that's pretty abusive. It's harming them greatly.
Reverend Keon Payton, we thank you for joining us, senior pastor at Pontiac's New Bethel Missionary Baptist Church. What are you seeing in your community right now in terms of the people who are coming to your church? And what are your thoughts about masking being perhaps abusive and unnecessary?
Well, thank you, Roop, for the invitation and allowing me to share in this conversation tonight. I'd first say that these past several months that we've been affected by COVID, we've seen complete devastation in the African-American community. I personally have buried a number of my own members of my congregation, as well as members of the community, to COVID-19. And so the suggestion that wearing a mask should not be mandated, I think it's preposterous. I think we have a personal responsibility to not only protect ourselves, but we have a social responsibility to protect others as well. And I think for me, the question of masking is really a question of our values. And I think as a culture, as a community, and as a society, we have the importance of teaching our children social responsibility. And so I have a 7-year-old daughter who will be going to second grade here in the West Bloomfield School District. And I'm grateful to the leadership of the West Bloomfield School District who saw the wisdom of encouraging our students to wear masks in the classroom. And so the conversations that I have with my 7-year-old is not only about protecting her own body and the importance of self-care, but also the importance of respecting others and valuing others' health as well. And so I appreciate the subtle suggestion that school districts that encourage mask wearing are teaching our children the right values of social responsibility.
Julie Madej, you're a parent yourself, just like Keon Payton, the Reverend here. You say that the masking is not something that you think is necessary. Protecting the health of other kids, making sure the spread doesn't leave the school and go back to a house where an elderly person or someone who's immunocompromised is there. Do you think your children have a responsibility to wear masks to prevent that from happening?
Listen, so I'm not against wearing masks, but we're in a completely different place than we were last year during the school year. There's two things we know. The first thing we know is that kids are not at a high risk of death. Okay, we didn't know that last year. We know that now. The second thing we know is that vaccines are readily available to anybody over the age, I believe, of 13. Last year the argument was, well, the kids aren't at risk for death, but the kids could go home and spread it to their family and their loved ones that were vulnerable. Those vulnerable people now have the choice to be vaccinated, and at this point, I don't see the risk in the kids going to school unmasked because the vaccines are available. So I feel like we're doing our kids more harm by making them wear a mask. I don't have a problem if anybody wants to send their children to school with a mask, but it's my choice as a parent. It's my choice as a parent to say, I feel my kid is safe. It's creating a lot of anxieties with our kids. Masks alone create fear. And the mental health that it's the toll on our children's mental health, it's always been there, but the masks make it that much worse. We need to get our kids back to school in a normal environment, as normal as possible.
Charlie Langton, I want to bring you into the fold. You're a dad yourself. I know you have grown children, but when you think a little bit about sending a child to school and saying that it's their right to not have to wear a mask, where do you kind of frame this and how do you look at this?
I think there are two issues here. I think it's one of the issues that we're talking about is, should you wear a mask? And a lot of people would say, yes, wear a mask. But the issue, though, that's problematic is the mandate mask. I know Tom McMillan is going to say, I don't want to mandate anything. I don't want the government to tell me anything. But if the government truly believes that masks are safe and that they are efficient and they're needed and they can prevent future problems, mandate it. I don't understand the fact that if the government, the higher ups, now again, there's some legalities here. Maybe the governor cannot do this. We've just seen that in the last year of COVID, but maybe the CDC on a federal level, or maybe the state health department. If they truly believe that masks are needed, same thing with vaccines, then mandate it, But
But Dr. Skrzynski, let me ask you the question real quickly about mandating it.
Probably the right thing. Let the school districts locally make their choice. Although, to me, at a state level, they pass the buck.
Dr. Skrzynski, good point there, Charlie. But Dr. Skrzynski, I want to ask you, when you take a look at the feds and others who aren't really enforcing a mandate in this particular situation, does that make sense to you at this point?
Not really. I mean, personally, I would like to see that mandate at a higher governmental level. And not only do I believe is that the correct medical thing to do, but also that unburdens the individual communities of having to undergo the strife of making these individual decisions, which are very difficult. If we had that guidance from the top, again, it takes away that decision making. One of the concerning things that I think needs to be brought up as well is right now we've got the Delta variant. Why do we have the Delta variant? It's because this thing has been allowed to replicate so many times through so many people. Every time it replicates is a chance for mutation. I completely agree. Children are very, very low risk. And I do also agree that a lot of people who are at risk have already had the opportunity to be vaccinated. But every time this virus spreads person to person, you roll the dice that you're going to get another mutation, critical mutation. It could dodge the immune response generated by the vaccine. We're back to square one. So that's something to consider.
Tom, what do you think about that when you hear the doctors say that this is something from a professional point of view he thinks is simply dangerous to allow children to carry this and really kind of pass it along to one another and then take it home?
Well, there's plenty of experts, epidemiologists, virologists, the great Barrington Declaration, people from Harvard that would disagree with this doctor. And, quite frankly, a lot of these hospitals are very reliant on the government, pretty much parrot what the government says and what they want them to say. They're dependent on Medicaid. They're dependent on, certificate of need to keep their competition out. So I really think that parents should make their own decision. They're smart enough to look at the experts. There's experts on both sides. The former CDC director, Redfield, just came out a couple of days ago and said he doesn't support universal masking of students. So it's not clear, and it's something that we know is harmful to children when you do mask them. If parents want to and they feel that there's a need, that's fine, but I think it shouldn't be mandated.
Reverend Payton, I wanted to ask you, I feel like in many ways covering this from the beginning for the last 16 months, I feel like it's a tale of more than one city here. When you look at Metro Detroit, you have Oakland County that has a more than 70% vaccination rate, and you have Detroit that has close to a 40% vaccination rate. And so, Reverend Payton, when you take a look at those numbers and you see those and you compare those, we're talking about two very different situations. And because of that, maybe you require two different solutions.
Well, I guess I'm struggling, Roop, with how we live in a society where you have to wear a seatbelt in order to protect yourself in driving, and that's to protect your own personal safety. Whereas we're living in the middle of a pandemic where simply wearing a mask can not only protect yourself but can protect others. So again, I just want to stress the importance of social responsibility that I think is a core central value to who we are as Americans, or who we should strive to be as Americans, protecting not only ourselves, but one another. As it relates to the comparison between Oakland County and Detroit, the Metro Detroit area, I can speak more clearly about Oakland County. I certainly want to celebrate the efforts of our county executive, Mr. Coulter, who's done a phenomenal job in partnering with the community, in partnering with local churches and helping us to not only educate, but also to vaccinate our parishioners. And there's really been a very strong campaign that Executive Coulter has executed that I think has really helped us in Oakland County. And so again, I'm in the Metro Detroit area, but I'm not exactly certain as it relates to what the government did there in Detroit.
RJ, I wanted to bring you into the fold here as a parent and a lifelong educator. When you're hearing this conversation, what are some of the things that go through your mind about the rights of these young people and the parents to be able to be unmasked in the school, and what your thoughts are about preventing harm from happening in these kids' homes?
Sure, and I think, Roop, the key term that you use there is harm. And that is on April 20th, 1999, any administrator, teacher, or child's life in America changed radically when the tragedy at Columbine High School occurred in Columbine, Colorado. For the 21 years since then, as a professional administrator, my number one job is to keep our kids safe. And what I will do to keep them safe is be conservative on every measure I take to make sure that those kids are safe. It's something that I've committed my life to. So I find it interesting that we would want to, instead of doing everything we possibly could, even though we pass huge school bonds to put cameras, automatic door locks, all of these things on our schools, when it comes to something that we know very little about, which is this Delta variant, which Dr. Skrinsky was talking about, I would err more on the side of being conservative in that piece on there. On the local control front, I find it interesting that Mr. McMillan would talk about wanting to mandate what people could or couldn't do across the state, yet also pushes back against the notion of mandates coming on. And so in that sense, our local control and school boards are put in a very difficult position, as Dr. Skrinsky said. And as such, in an age where everybody has a voice, but few people have accountability, our school board members across the state are being put in situations that are increasingly difficult.
Mr. McMillan, I want to give you the chance to respond to that. I know you said you did not say that, but what did you mean when you originally had talked about that?
Right. I'm a local control person. I would prefer that the state be as small as possible. So I do not want any kind of mandate. I wanted the board to take a position that they don't support mass mandates at the local level, but that would not have any authority. I don't want the state to be dictating. When the state starts dictating health policy, it's all about politics, and that's what we see. It's what we see from Whitmer and her health people. It's not science, it's politics.
And I would
Bottom
agree.
line, if you're like a parent like Julie Madej and the others on here, of course, who are watching this tonight, you have the decision to mask up your child or not if you want to make sure that they don't carry this virus or the threat of it around. I want to thank our panel for joining us on this end of the conversation. When we come back on the other end of the conversation, what about your workplace? What happens when you go back to work? We have an employment attorney and a strategist talking about the messaging around getting vaccinated and heading back to work when Let It Rip comes back after this.
Thank you.
Welcome back to Let It Rip. When it comes to messaging around the pandemic, I don't think it's a stretch to say government and businesses could probably be doing a better job. But with what we know about the virus changing so quickly, so often, is it even possible? Charlie is back with us, and we're also joined by employment attorney Deborah Brower and public relations expert Matt Friedman, the co-founder of Tanner Friedman PR, and Deborah, of course, with Nemeth Law. We thank you all for joining us today. Let's just throw this out here. Matt, I want to begin with you and ask you the question about the type of messaging that we've been hearing. You heard people say, if you get the shot, you don't have to wear the mask. Those public service announcements are still running today, and that's just not true anymore.
It's been a real challenge, Roop, and just walk into a grocery store and people just aren't sure what to do. Do I wear a mask? Do I not wear a mask? Am I in the right county? What's the transmission rate in my county? It's very confusing, especially because, as you note, back in May, there was a day when the government told us if you're vaccinated, you don't have to wear a mask anymore, presumably ever. And it was like VE Day and the last day of school all rolled into one. People celebrated. The pandemic felt like it was over. Now it's changing, and change communication is something my colleagues and I have had to do a lot of the last 18 months. And the rule of thumb is to keep it clear, concise, consistent, and cliche-free. For the government, it's been anything but, and it's led to a lot of confusion. It's easy to Monday morning quarterback this stuff, but in the meantime, most people are wondering, what am I supposed to do? That's a shame.
Well, you heard the Fed say, initially, wearing a mask, and then you heard a little bit of doubt being cast very, very early on about whether or not masks were effective. And then a quick switch saying, yes, they are effective and you must wear them. And then, hey, if you get vaccinated, you don't have to wear a mask. And now they're saying, even if you're vaccinated, you should. That can cause a problem in a lot of circles, including in the workplace. Joining us now, as we say, is Deborah Brower as well on Let It Rip. Deborah, what are you seeing right now? Are you, as an employment attorney, are you seeing caseloads pile up of people who are saying, wait a minute here, I don't need Big Brother breathing down my shoulder?
Well, it is becoming a problem for employers. As Matt said, people have had to pivot quickly and change messages. And I think companies are sort of filling some of the gap because the government message has been so unclear. So companies are now returning to mask requirements. Companies are starting to mandate things. Having people voluntarily decide to get vaccinated wasn't working. And so now we're starting to see the return of rules back when people thought that the rules were off, that we didn't have to wear the masks, we were all going to be okay. So I think employers are seeing some pushback. They're seeing some disgruntled employees. They're seeing anger in the workplace because the vaccinated people are angry that they now have to wear masks again because of the unvaccinated. So it is causing tension and problems for employers.
Social media is one of the worst places to get your information. I hate to say it, but it's true. And I recently just saw someone tweeted saying my boss has no right to ask me whether or not I'm vaccinated or not. That's violating HIPAA. Absolutely false, that statement. It's not violating HIPAA. A boss does have a right to ask you if you've been vaccinated. They can't ask any further questions. Deborah, talk a little bit about that.
That's not the law that's at play here. The laws are disability laws and some privacy laws within the workplace. An employer can ask whether you've been vaccinated. They can't ask you why you chose not to get vaccinated. They can't delve further into the medical reasons. But the EEOC, which is the Equal Employment Opportunity Commission, said that it's okay to ask, it's okay to require vaccinations. You just have to be careful about how much further you go with information with these
Charlie,
questionings.
talk about the slippery slope that we're looking at here. How much can a boss or should a boss go forth in terms of trying to mandate this stuff? And you also have a shortage of workers out there. So it's kind of a catch-22 for a boss out there.
Let's make this real easy. The boss can do what the boss wants to do. If the boss wants to have every single person in the workplace vaccinated, that would be legal. If the boss wants to have everybody in the workplace wear a mask, I would say that's legal. If the boss doesn't want to have people wear masks, that's legal too. If the boss doesn't want to have any vaccines, that's legal too. So where does it go? It becomes either political, it becomes whatever. Now, there may be some legal exceptions. I'm not sure. We haven't had a lot of cases on this. If there's a medical reason, if there's a religious reason, that may take it out of that. But I don't think anybody has a right to not wear a mask or wear a mask. We haven't had a lot of court decisions, but I would say that based on that frame, the problem here is that we don't have a lot of guidance. We had guidance, people didn't like it in the first part of COVID, where the health department said, you have to wear a mask, you have to social distance, you have to do all these things. And that was the law. Bosses had no choice. And how many restaurants did you go to and say, the law says social distance, wear a mask, etc. And I think a lot of bosses or restaurant owners or whatever like that. They want guidance because when they have to make the decision on a local level, it becomes problematic. And then you get disgruntled employees. And that's not good for anybody. So that's, as I understand it, that's the law. But for some reason, we're not getting good guidance legally from the higher ups. That's a problem.
So, Matt, let's talk about good guidance and messaging at the same time for just a moment. And let's frame it in the air, if we can, for a moment. The airlines have had quite a ride the last few days, hearing about one airline saying, we're going to ask everybody to get vaccinated. And then another airline came forth and said, hey, you don't have to. What's behind that message?
Seems to me like they're trying to balance public relations with human resources and employee relations. As Charlie indicated, it's a tight labor market right now. And so United went out and said, every employee has to be vaccinated. You would think that would give some cover to the other airlines, but they have to do their own calculations about what that's going to mean to their workforce. These are tough decisions that companies have to make right now that would be made a lot easier, it would seem, if more people would get vaccinated. But as you mentioned earlier, thanks to social media, thanks to a culture that we're in right now of misinformation, of disinformation, and really very innocent confusion, there's a lot of people that were expected to get vaccinated that haven't, and that just perpetuates this. This is just going to keep going and going until we hit some numbers that will make this meaningful from a health perspective. It's a big challenge for communicators and HR people and lawyers alike.
Look, these infection numbers are going to continue to go up because even if there are breakthrough cases where people aren't hospitalized, infection numbers because of this Delta variant will go up. And so because of that, there's going to be an urgency with employers who want to do the right thing for the company. Deborah, I want to leave it with you on this discussion and talk a little bit about what to look out for as we head into the future, the next 3 months, 6 months, year, when it comes to the employer and the employee.
The employer has to be flexible, I think be open, explain why they're doing things. If they're going to mandate, whether it's masks or vaccinations, if they're going to mandate people coming back to work, because that's a hot issue right now too, they have to give, I think, a lot of fair warning for people. They have to be flexible in allowing exceptions to be made. But they also have to be sensitive to the people who are at work, who are masking, who are vaccinated, who may feel that they're being treated differently. So there's a lot of balancing of interests. I do think employers have some cover because even though we don't have those rules from the health department, the state does have a law saying employers are required generally to provide a safe workplace to its employees. So I think that's what employers need to say to their employees. We're trying to keep you safe. We're trying to keep our patients, our customers safe. That's why we are doing what we're doing. We're trying to balance it. And on the flip side of that, the employees have to be open-minded, I think, and listen to what the employer is saying and be on the team, be on the employment team, the business team.
And that's a tough team to be on. It's a tough team to be on right now because of all of this strife, but we're going to continue this conversation in a moment. But first, when we come back, our own Charlie Lankin, who can get people to say things that you'd never imagine when he takes Let It Rip on the road. We'll be right back.
Masks or not wear masks for kids in school?
Kids in school masks.
I am a teacher. I plan on wearing a mask, whether it's mandated or not.
Do you think that the government should say, wear the mask, get the shot?
Well, yeah. Once you say mandate, then you start getting the people to rebel.
I think option as a parent, But I feel safer if my kid had a mask on because we don't know what virus is going to take over next.
COVID. Where's the end game?
Wow.
The end game is when we're all safe, when everyone can walk around freely without having to worry about being getting an infection.
You will wear one until we get this pandemic in order.
I don't think it's going anywhere. I think we just have to stay cautious and know that it's going to be here and just adapt to it.
And there you have it.
Oh, that's all we have for today. That does it for this edition of Let It Rip.